Hello. I welcome you all to this session, one of the last at this wonderful congress that it's been. This session is going to be about international healthcare innovation ecosystems, and I'm very happy to have the honor to guide us through it. We'll have 4 international speakers speaking about the respective healthcare systems and how digital health is working in these areas and globally. My name is Svea Krutisch. I am in market research with Dr. Alexander Schachinger, who you will also hear from later today. And I am also active in the patient community in advocacy in diabetes. So I have the honor to also kind of give a bit of insights into that. And I think in a lot of cases, it is often viewed as the patients not being ready for digital health or having fear of something that is beyond just the normal healthcare systems, but actually in a lot of communities, especially in chronic diseases, patients are doing innovations themselves. They're inspiring innovations in the medtech industry, and it is very interesting to see how these innovations or also thoughts that patients themselves have for these creations are then being taken into the respective healthcare systems in the countries, and how these advances are being made globally. So I have the honor to now announce Dr. Alexander Schachinger, who will give us, first of all, a bit of a global insight into the drivers and inhibitors of digital health. I'll hand you this.
This is microphone number 4 is working. Good. Test, test. Hello, hello. Lovely good morning also from my side. Thank you, Svea, for the warm introduction. A little bit over the next 15 minutes, I give you some insights about how especially electronic health record and e-health ecosystems from governments in European countries mainly failed. Failure is nearly a pattern you can anticipate. And also I failed in a project. I wanted to map out the IT ecosystems of a variety of half a dozen European countries and its e-health and electronic health record ecosystem, but I failed. We are a nice, smart speedboat company, but we are not the Spanish Armada. So, but what happened unintentionally, that somehow when I talked to the experts in Switzerland, United Kingdom, Netherlands, Denmark, that somehow unintentionally we made insights of how subtle, sensitive dynamics help or destroy the rollout and the adoption of electronic health records and healthcare systems, digital transformation. And this is very interesting, and this thing is still going on, this project. I want to travel again to these countries, and I will give you right now already some of these insights that are very human, political, smart, network-based, and very subtle and sensitive. And maybe some of these 3-4 insights right now. What we actually do at EPatient Analytics is unfortunately only in the German-speaking area in Germany. We map, observe, investigate, research target groups, patients, the e-health market on a traditional B2C and market research area. And our customers are big pharma companies, governments, health insurances, and similar to understand their target group and their market. So this idea, especially in the dilemma or in the ongoing 20 years of electronic health record introduction in Germany, it's a long chapter. I tried to give insights based on the situation. Hey, Germany, many governments and politicians are maybe, you may heard of this fable of the frog in the well. There are many frogs. I am a frog, we are all frogs, and we think from a well. This part of the heaven we see, that's the reality. That's the world of chances, but it's only an area of the heaven and not everything. So the idea is maybe to leave the well and look outside what else is going on. That was the intention of the traveling. And simple failure or insight number 1, that is what many people who are between the experts of government and e-health, electronic health record rollout in the reality in the countries told me always the same at the end, saying we didn't manage to take the people with us. So it was mainly a naive, mainly aggressive, political, regulatory, top-down process without an open, transparent process of taking the people, also the doctors and the medical community with them. And the opposite is maybe a minimal viral product innovation or shared decision-making. All these things were neglected. It's always the same top-down failure, especially in Germany and Switzerland. Both of experts in these countries said this is a big failure dynamic. Simple example. In many countries, they said the digital web-based record inside of the medical history, the medical record, the medical track of the patient is a tipping point, a driver, an adoption driver for doctors to use web-based patient record tools, electronic health record tools. And contradictively, in also some countries, they said, no, that's not a nice thing because as a doctor, we as doctors, we don't want to see that Big Brother is observing us when we use off-label drug use or when we make our individual diagnosis. So these things are contradictive. These observatories, I told you right now, are quite contradictive. So I went to the experts with these contradictive moments and insights. And especially the Nordics, they said, well, Alexander, especially you in Central Europe, you do mostly these top-down failures. What we in the Nordics did is that we did new web-based interventions or web-based innovations with a group of 2, 3, 4 doctors who already know themselves on the other side of the street and who do beer drinking or golfing or private stuff already, and they know each other in a little small trusted circle. And there they did innovations that the doctors tried out, and then they liked it, and it went bottom up. That's a very sensitive dynamic of innovation instead of top-down regulatory aggressive. And we all know these things as a MVP approach of software development, and the Nordics, they plainly, simply did this as a best practice. They do this since 20 years. They do this already today. Another failure, very, very traditional in big countries mainly, is doing these decisions, these regulatory decisions behind closed doors, and not participatory and inviting all healthcare stakeholder groups together on a common ground, round table, sort of like the King Arthur round table, or when different tribes sit together for a progressive chat smoking a pipe. A small country called the Netherlands, they already also failed in the first approaches in the electronic health record. UK failed, by the way, also with 12 billion pounds burned, very interesting, 2 times. But then they accepted that they failed. And sometimes we or I miss the fact that, for example, Central European countries accept their failure. Accepting failure is maybe not easy also on a human level. The Netherlands right now, they do an agreement on a common ground that everybody of dealing with the healthcare system made an agreement for a progressive digital data-based innovations. And that is a nice, positive moment, preventing these failures I mentioned right now. Another nice example, you may think if you watch the news that the NHS, the care system in United Kingdom, is failing or will fail. There are big problems of lack of care. And out of this need, maybe, they did a finally nice thing. They did many touch points leading to one NHS app. And within this NHS app, you have medication history, triage, chat, doctors, personal health record, tailored information for your care, only in one app with one login only. And if you ride the train or in public transport, if you are around in the United Kingdom, you have posters, you have public health posters. When you feel bad or if you're anxious, call this number, use this website, or use this Google search term. This is all the one single spot which also leads to electronic health record. So it's one-stop shop approach, and this is a benefit of doing it centralized. And I think Anglo-American countries have, of course, a very learned tradition of public health instead of other European countries. So this is very centralized and very observable and touchy for the citizens, the patients, the insured people. And this is also a reason why after 2 failures in the United Kingdom, now around every second person in the United Kingdom uses the NHS record app within 3, 4, 5 years. That is very fast, very, very fast. Compared to Germany, sorry for those who don't speak big German, I describe it in 2, 3 sentences. In Germany, it's a fragmented, chaotic, fragmented market. You have thousands of websites, startups, and apps that are not orchestrated by the care system, by the health insurances, and not by the government. And you have many citizens who, like Svea said, don't wait for their centralized digital innovation care. They improvise and do their own stuff. Simple example, talking about the digital prescription, the electronic prescription, what around 17 out of 100 Germans above 18 years understand of their digital prescription is making a photo of the ethical prescription from the doctor on the paper, making a photo with a smartphone and sending it over WhatsApp to their brick-and-mortar pharmacy or to the pharmacy chain. So this is their thinking and their improvisation of electronic digital prescription. And thinking of electronic health record, they use, of course, Google Drive, Dropbox, and others. So they don't wait, but that leads to the result that you have a fragmented system and fragmented improvisations in e-health, and especially young progressive patients are doing many, many, many things. So that's quite chaotic. That's the status quo. And I think it makes sense to learn from each other in the European community or even in Europe on a geographical level, and to put these insights and especially the culture and insights of failure. And with many experts I talked, they said they see an observable pattern that governments will fail. But accepting it, opening it up, and tolerance to failure is maybe a big thing we need all. Then this is it. Thank you very much.
Bleibt mal noch oben, falls es Fragen gibt. Okay, thank you very much. We now have time for maybe a couple of questions, if anyone would like to ask one about the failures and best practices that Alexander just described, or some of the market research we do in Germany. Are there any questions right now? I don't think so. Oh, up there. Yes.
Don't think very much. You have prompts. You have an evolution of. Yeah. You have not very much. You have patient-reported outcomes as a software a little bit concerning really interventions, and you have an evolution of patient portals at clinics. There they make aftercare, like in an information therapy approach, saying the right information to the right patient at the right time. Oops. But there is much potential talking about real-world evidence, outcome, long care, and secondary and tertiary prevention. That is, especially talking about digital interventions, there's much potential still, very much.
Yes, maybe I can also chime in on that from the perspective of, me being a diabetes patient in Germany. So a lot of times, actually, it's not considered that much. I think it's getting better as it is internationally. We have PROMS studies and things like that, but I think there's a long way we can go and we can learn from other countries. But I think this is a great way to introduce you as our next speaker. So I'm happy to now welcome to the stage Dr. Hamzeh Awad. He holds the Health Informatics Research Chair in Abu Dhabi and is an expert in health science, higher education, and digital health programs with lots of international experiences under his belt as well. And I'm very, very happy that he's now going to give us some insights into digital health in the Middle East. This is yours, and you need a microphone. So
oh, it's working now. I would like to start my presentation to extend my thanks to Martin, to Judith, and the organizer of this conference who invited me to be part of this conference today. This morning we had a presentation about some of the research aspects done by the students related to the applications of AI and machine learning for predicting diabetes. And now I'm going to present some of the ongoing programs, what's going on in the Middle East in general, with emphasis on the GCC countries, mainly Saudi Arabia and United Arab Emirates, as leader for applying technology toward healthcare. The market is expanding, and I remember when I was in Germany, I have to say that I lived in Germany for from 2008 until 2012. I was part of Ludwig Maximilian University in München, School of Medicine, and I did my PhD there. I had a chance to spend 1 year in Dresden with the TU Dresden, with the Klinikum Krankenhaus as well for research for diabetes. And we had a chance to spend a year looking at how we can apply a new model for diabetes prevention. And one of that was related to digital health. In that time, I remember digital health was at the very early stage. Many people don't prefer to apply it directly. There was some wonder about some of the aspects related to the data sharing, data security, and so on. We still have the same problems. I'm thinking of the same that what we experience nowadays in the Middle East, where when we are saying that we want to apply a lot of the technology, people believe in the technology, people love the technology, but when it comes to the personal health care, it requires a lot of attention because there are certain types of diseases. Once that you think that you can apply technology with these diseases, you can prevent it. And one of these are diabetes, for example. Now, in order to have a complete understanding between technology transformation and technology adoption, this is the big challenge, one of the biggest challenges that we try to explain to people, that if you have a smart watch using this to predict your number of steps per day, this is adoption to the technology, rather than when you have a system allowing you to have a better physical activity, the more the better. The more physical activity you do, the better that you can have. You can build your personal key performance indicator, and you can monitor your level of physical activity using the technology. But if the system is there helping you to adopt this in your life, and this is going to be transferred between you as a patient and your physician or healthcare professional in the hospital, this is the system that will keep the continuity of the care and will help each one of us to be in a better health. So my presentation, actually, when I was asked to do this, I was a little bit thinking about so many things that we can do and we can present here about what's going on in terms of digital health transformation. My introduction today is going to talk about the Middle East and how the Middle East is emphasizing on the digital health transformation. I'm going to give some examples of the digital health transformation systems that used already nowadays, and share with you some of the very interesting information about applying digital health transformation at different levels. And then we'll share with you some of the challenges, and we learn from each other. We open the door for collaboration always. We all open the door to think about industry academic collaboration. These days, I'm working intensively in the higher education to build curriculum from industry perspective. And this is a complete, comprehensive, enormous trend these days, and shift in building curriculum for health and health-related courses and degrees. And some of the promising digital health technology already in use these days, and some of the insight about the future of the digital transformation in the Middle East. We all know that COVID came to change the world. After COVID, the world after COVID is different before COVID. Applying technology, some countries at some point when COVID started and lockdown, most of the places they have, or most of the countries, they have their own policy to do the lockdown. Some places they have complete lockdown, some places some hours, and every country has its own way for trying to protect people from this little virus. Now, one of the very challenging points during COVID was to get people in a healthy condition and to access the healthcare system or to access the healthcare facilities. I remember there was a complete lockdown. You could stay just at home for days, and you cannot even go to the hospital unless you are in a very critical situation. And this raised the importance. A few years back, I remember I stand and talk about the role of telemonitoring for predicting diabetes and cardiovascular and applying telemedicine, and how this impacts the life of people, and how this can build the ecosystem for health system in different Middle Eastern countries. Many people think that it is not the right time to talk about it that time. When COVID happened, I just saw that many people say, yes, you are right, that some places they applied this, they were able to access their patient. So I called and they said, okay, you have telemedicine appointment, now you can talk to your doctor. Before that, it was so difficult to do this. So referring to one of the, if not the only advantage of COVID, that applying technology becomes more accepted in the society and more applied in a different level. Plus the fact that many people are more into the technology, and young generation, they love to have the technology at different levels. And technology is going to increase in the population, and the population also increase in an enormous way that allow them to use the technology in different levels. So one of the key aspects of digital health transformation in the Middle East is we are fortunate in some countries, some of the GCC countries, that providing a lot of support to people to have, or to hospitals to apply different systems that allow them to access their patients from home and do the telemedicine and try to have this technology. And on the other aspect of the Middle East, there are countries who have no money to apply this sort of technology, and this will influence the healthcare system and influence the care for people as well. There's not enough number of doctors to see every single patient in every single case. So the technology is enforcing the system to be applied in a way that they can use this. Electronic health record, a few years back, 10 years back, most of the hospitals, they were using paper-based. And nowadays, there's not even one single hospital using paper-based anywhere. It's completely with no papers. And this is very nice, because I've seen in different countries, and I take an example, Saudi Arabia. I worked there during the time from 2013 till 2016. And we had, I was responsible for one of the largest medical city. They have a very nice electronic health record applied in a way that taking the perspective of patients and taking the perspective of healthcare professionals and make this as a decision supported by evidence. And that was one of the very multidisciplinary approach that used in clinical practice in that time. Was very unique. So applying electronic health record or medical record is something that we experience. We do have different electronic medical record companies coming to and use in the different hospitals. But the most famous companies that already existing in the Middle East, as you are familiar with, is Cerner and Epic. Despite the fact they are expensive, but most of them, series of hospitals or governments in the GCC, they use Cerner and Epic in order to have a better electronic health record. Telemedicine. I shared with you the experience before COVID, and nowadays you can easily just book an appointment and just say, I want to have my appointment with the doctor over telemedicine. I don't need to drive, wait, get myself at risk to expose probably COVID or any other virus in the hospital. I don't want to waste time just driving. There are so many advantages for using all of these things. The last point, or the second point here in this slide, is applying AI and machine learning for predicting diabetes or cardiovascular or non-communicable disease. It's at the early stage. One of the stages that I was considering when I did my research, why we don't use the machine learning in order that we can select the best algorithm to analyze the risk of the disease before it happens. And then we apply this to public health centers and say, well, this is how you can screen your risk. This is how you can shift your lifestyle. This is how you can prevent this. Then the idea came, we apply it, we did the research. And this morning I was sharing with the people the outcome of the research that one of the machine learning algorithm, random forest, was very sensitive to predict and to analyze the data for the screening of diabetes using different type of scoring system that we applied with people at different level, with young generation, to tell them if they are at higher or lower or moderate risk of developing diabetes. So in the future, I expect to have more of this. We expect more of the applications toward different healthcare practice to apply AI and to have feedback to patients, feedback to doctor, connect the patient with the doctor and build a strong correlation between the patient perspective and the doctor perspective. I experienced this in 2014 in King Abdulaziz University Hospital in Jeddah. We did a project in collaboration with companies from Belgium. We experienced prevention of gestational diabetes. So we monitor pregnant women who experience diabetes during their pregnancy. And we were successful with our project to reduce the risk of HbA1c 1 degree for the women over the period of pregnancy. So we helped them to shift their lifestyle using telemonitoring in that time. And it was one of the unique projects in 2014. I'm talking about now almost 8 years or 9 years back. Using wearable and mobile health application becomes very useful these days. We all have a lot of applications on our mobiles. We use this to count number of steps. We use this to access our data, to access our medical record. I know in my mobile I have different applications for different hospitals where I usually go. I do a general checkup, or I can access all of the data. One of these, for example, Cleveland Clinic in Abu Dhabi, they are very famous with their application, and people can apply it and access their doctor and share the information between the doctor and the patient. It's a very interactive model, for example. Public-private partnership, and I would like to emphasize on this, there's a lot of support to graduate companies in the universities. I'm a big supporter, and I'm working with the university to help students to graduate their projects, the capstone projects, to be an entrepreneur company that sort out a problem in the society. So we apply research to practice, and we help them to get more of this type of work that in a company or let's say in a business related after they graduate. So they don't seek a job, they have their own company and they can employ others. And this is an open call for companies who would be happy always to integrate with the students, or they have students and they wanted to test the market and to come to the market. That would be more than happy to discuss with you after the presentation how this practice is conducted. Examples of digital health transformation. I'm going to share with you some of the examples of the terms. Sahati, for example, it's a word in Arabic, means my health. And this is one of the applications used by the Ministry of Health in Saudi Arabia. And Saudi Arabia did a lot of enormous changes in their structure to build clusters. And these clusters consist of different hospitals and clinical centers connected with each other. And they built Sahati program for people to access this. And it was active during COVID and very helpful for patients. In Dubai, Dubai Health Authority, as well as Abu Dhabi Health Authority, you may ask me why both of them, they belong to the same country, but they are different in terms of structure. In Abu Dhabi, they have a program called Malafi. Malafi means my file. The file is, if you go to any of the hospitals in Abu Dhabi, there are two types of files. One file for the hospital, and one file is the master patient index that connected to Malafi. And this Malafi can be accessed anywhere in any of these hospitals. So the doctor go with the username and password. Any of the hospitals connected to Malafi in Abu Dhabi, they can see the profile of the patient. Many, many advantages for this Malafi because, and in Dubai they do the same as well, they avoid repetitive of tests. If the patients need to do any radiation therapy or radiation for diagnosis like MRI, CT scan, they don't have to do it again because there's no access, or they have to worry about taking the CD and move from one place to another, and so on. And they can share the information on that file while other doctors, they can see what other places has done there. So that avoid a lot of medical error, a lot of issues that happens because of the different perspective of different therapists or different healthcare providers. And also, at some point, this can be connected with telemonitoring in some hospitals. As I mentioned before, Cleveland Clinic in Abu Dhabi, they have a telemonitoring application that interacted between the patients and the doctor. One more is Hand at Hand, which is a telehealth program that in United Arab Emirates that's established to provide more about the virtual consultation for telemedicine. And it is useful also that to access patient care, for example, long-term disease, like non-communicable disease. You don't have to go to see the doctor every second day or every week or every month even. The same protocol has been, you can experience every 3 months. So you can access your doctor using this type of technology without going there and spending a lot of money in terms of insurance base or in terms of the cost and the hassle that the patient might face during their visit. Now we come to the interesting part, which is the challenges. Challenges depends on the places. There are some countries, they have challenges not related to technology itself, it's related to the people applying the technology. Some places, they don't have fund to apply some of the, or they don't have the good infrastructure to apply this. There's some changes with time. Changes take time usually. That's the nature or the way how things is doing in the Middle East. It might take more time in some countries. Some countries, they are more faster than others. And I've seen the United Arab Emirates as one of the very good examples for applying technology and adopting technology and build the transformation in a quicker way than other countries because of the availability of the infrastructure and the support that they receive from the government for that. Language and cultural barriers. Some of the application used, it doesn't have Arabic. As you have here in German, not every single person, I think, live in Germany speak English. So you always have to translate this in German, or people, you want to benefit everyone, then you have to build your application in German. The same things in the Arabic countries, they have to have the Arabic language available, and people would be able to access this. For me, it's easier to use the English, as I'm familiar with the medical terminologies and I apply it, but some other people, they prefer to use the Arabic in terms of their way of practice and so on. So the language is one of the challenges for some of the applications in order to be successful with their business in the Middle East. Data privacy and security with the HIPAA regulations and HL7 and some of the regulations that international regulation, not all of the companies, they do apply the data security and share the information and storage. Though, so Abu Dhabi has very, very restricted rules for sharing and providing and hosting the information as an example. Limited funding, as I said, some of the places, they don't have enough fund to apply the digital health transformation in a proper way, so they are seeking more of the support from the industry and probably providing more care at different levels. The last part of my presentation is more about the promising, what we are expecting to have in the future. I know that, for example, today we are going to visit probably Helios as one of the virtual clinic. And it is very good aspect to have a virtual clinic that taking care of patients. So we do have, we have to differentiate between the digital or virtual clinic and telemedicine. So the concept of virtual clinic is still not coming yet. It's good to see how this can be applied, that we can have complete virtual clinic from A to Z. And this is a very big topic, and it's very interesting, so mainly for certain types of diseases where you don't have to apply emergency. Telemonitoring. I'm a very big fan of telemonitoring application. Telemonitoring is very useful and successful at different levels for non-communicable diseases with hypertension, cardiovascular, diabetes, and others. It provides a lot of promising information at different levels and give a lot of care for people and help them to monitor their lifestyle and monitor their disease. Blockchain and artificial intelligence, as I said, it's good for connecting and securing the data and helping all of these together and putting all of the information in one pool and share it with different governmental and other hospitals in between, and applying AI as a positive and negative feedback for patients to build an interaction between the healthcare provider and the patient, very important. I'm a big believer of the perspective of the patient, because I remember over my long journey, over 20 years, as a student or as a worker, a patient perspective helped me to cure the patient. My early stage of my career was looking at diabetic foot problems, and most of the amputees happened when I remember that when I was working in the hospital, because we don't understand the situation of the patient and how they can manage to do their life. So we take their perspective. I know that a person that with a wound care, take care of the foot, is someone that need to think too much about how we can make patient walk and have a healing in a higher rate. That was very problematic in that time, and many people get amputation because of that. I came up with an idea in 2007. It was considered the second best project in the UK for my master degree, to avoid all of this hassle, and by making patients walk on air, by building offloading technique, we're using biomechanics of the foot to help them to have a better care. So I use the technology to help the patients to have a better healing, and we applied this in practice, and then we have the perspective of patients. It was very important for me when I came to the idea that I wanted to work on offloading, to hear the patient, what they wanted to do and how this is going to help them, and then to hear them after that and how this impacted their life. I would like, again, at the end, just to thank the organizer, Mr. Martin, and everyone for inviting me here, and I would like to thank you all for taking part of my presentation, and I'm always happy to have any question about the digital transformation in the Middle East. Thank you very much.
Yes, thank you so much for your insights into digital health transformations in the Middle East, and also especially for the focus on patient centricity, including patient perspectives, and also, of course, the language and culture part, which I think is very, very vital for developing then digital health applications that actually can be used to manage diseases, or even, as you said, prevent or predict diseases like type 2 diabetes. I think we covered a lot of different topics, so if anyone has any questions, then please shoot away. We have microphones to give around.
I usually prefer to do the session as an interactive, but I know the topic is very not interactive stylish. So I'm more than happy to answer any question either now or later.
Okay, it doesn't look like there's any now. We still have time for overall questions
That means
later.
my presentation was clear.
Yes,
so
you answered all of the questions already. Okay, thank you so much. I will take this. And as our next speaker, unfortunately, he cannot be here today, but we will have a virtual presentation from him pre-recorded. So I'm happy to now announce Antoine Tesnières. He's a professor of medicine and the CEO of the ParisSanté campus, which is a digital health development center created in 2021 by the French government and French President Macron. And it fosters research and entrepreneurship, especially in France, as a digital health development center. And we will now hear from him virtually.
Hello, my name is Antoine Tesnières. I'm the director of ParisSanté campus, one of the leading healthcare innovation centers in France. And I'm happy to share with you some of the insights on the way France is helping digital transformation of its healthcare system, of course with a vision of a coordinated EU transformation. France has been heavily involved in healthcare for a long time with many great discovery and organization. And of course, the digital transformation of its healthcare system is a crucial aspect of the way the systems work. As in many other countries, it touches a number of parameters that needs to be readjusted and be adapted to the needs of the healthcare providers and the expectation of the population, in line, of course, with the evolution of innovation, research, and discoveries. Digital transformation has started in many aspects of our daily life: transportation, communication, music, and so on. Healthcare systems, at least in Europe, are regulated, and governments need to help them to evolve and to be transformed with the use of data and digital tools. That's why digital transformation started a few years ago with a relatively slow pace and is gaining more and more speed, not only due to the recent epidemic crisis, but also due to the impact of fast-paced innovation and new regulations. The potential of digital transformation in healthcare is huge. Data sharing, better diagnosis, better information for patients. A number of aspects will be completely transformed for the best of our healthcare system and for the best for our patients. One of the questions is how we drive this into our healthcare systems and how we think this into an international vision and a coordinated organization at the level of European Union. For the last few years, France has been delineating new policy, new organization to help the implementation of data strategy, of new tools, helping telesurveillance, for example, helping telemedicine, giving fast access to innovation. Since 2018, one of the public policy called Ma Santé 2022 has established a roadmap for healthcare system to evolve. With the help of the healthcare minister, with the help of all key players, the goal of this roadmap is to set the stage for healthcare system to adapt and to enter data strategy, to fund new regulation policy, to fund new infrastructures, and to help everyone, patients, caregivers, deciders, to adapt to this new reality. Today, the French healthcare system is using data strategy and digital tools at various levels. The use of data is dependent whether you look at hospital, out of hospital care, home, etc. The vision and the goals are stated in the roadmap from Ma Santé 2022, and we try to help the key players to adapt to this roadmap and to keep up with the objectives. Of course, the everyday transformation in other daily life sectors is helping everyone to understand the benefits and the potential of data and digital tools in healthcare. If you take the examples of travels, for example, digital tickets on our smartphones is a good example of how you can digitalize healthcare data and use it in the hospital. One of the key players in France for the digital transformation of healthcare is the social security. For a long time now, the social security has gathered a large national database for all French citizens, gathering healthcare data in one single data lake that is accessible and that provides crucial and very important information for research, for daily operation, and for future developments. This healthcare database is supported by the use of digital social security cards, for example, helping the patients to easily access to their information, and the caregivers also to send and to provide information to the social security. This historical involvement in digital use of data for the social security has been recently improved by the emergence of a platform, a web-based platform for every patient and caregiver called Mon Espace Santé, my healthcare data space, that is now accessible for every French citizen, every healthcare provider, with the aim of hosting and sharing patient data and application to use and analyze this data. The COVID-19 crisis has been a major accelerator of data use and digital transformation of the healthcare system. It gave the opportunity for everyone to understand the benefits of remote monitoring, telemedicine, use of large data sets to prevent and to predict the evolution of epidemic, and gave everyone the potential of use in other fields than just handling an epidemic. Europe also, in healthcare, has gained from this in increasing its healthcare coordination with all the member states and has been accelerating its healthcare policy, but we will get back to that at the end. When thinking of important topics around digital transformation of healthcare, of course, everything that relies around data is essential. A number of topics are discussed and addressed at the moment in France, and some of them in coordination with other countries at the level of EU coordination, of course. But the way we delineate strategy to collect data, for example, between hospital, home care, caregivers, is one of the first aspects. And what we see is the emergence of Internet of Things and monitoring tools will provide new aspects of data collection for healthcare patients, helping also to move from cure to prevention strategy. Once collected, data needs to be stored. The emergence of large data storage within hospital is one of the major trends in France at the moment, and the government has issued funding to help hospitals and hospital network to a larger extent to set up data storage initiative that can be shared throughout the country. In line with this, interoperability of systems and of data is absolutely essential when thinking of the way healthcare provider and patient can exchange data when traveling or when changing hospital or when moving from one city to another. Once collected and stored, data needs to be analyzed. With this respect, we all have seen the emergence of algorithmic strategy. For a few years, on databases, on images, and now on language, with the very visible evolution of generative artificial intelligence. Even though it represents the visible part of the iceberg, a number of algorithmic strategy has been organized and evaluated on the use of large number databases or image and video analysis before the emergence of generative artificial intelligence. All these strategies will help to bridge a number of gaps, to improve a number of organization, to help decision in clinical setting, to help diagnosis. And most of the scientific evaluation today is showing the crucial impact of the combination of artificial and natural intelligence in providing high performance for diagnosis, for example, for our patients. This field will evolve very fast, and you just need to look at the improvement of performance in ChatGPT between third and fourth versions in a couple of weeks to understand the next steps and how fast they will come. In the end, it will be very helpful to strengthen performance in our healthcare system, to be able to use these new tools, of course, provided they have been undergoing the right evaluation and been showing the right performance. Getting back on the way we can share data, setting interoperability standards is absolutely crucial from the start. We see too many databases that have been built over the years with silos and that are not able to exchange and connect. With this respect, it's been France and to a larger extent European choice to use the SNOMED CT system. It's really important that we all share the same standards and that we define interoperability as a key standard for building healthcare data strategy and systems. Last important concept is the reality that healthcare data are heavily attacked. We need to provide sufficient security system to make sure that we can guarantee hospital, caregivers, patients, and to a larger extent, healthcare system, that data is safe and that we can protect our data storage system and to a larger extent also the way hospitals work. There have been a number of important attacks in France as well as in other countries. We now have proof that unfortunately people died after cyber attacks. And it's absolutely important that we also work together in defining security standards, understanding where the attacks come from, how they're conducted, and how we can not only protect our system, but also adapt to a very fast changing reality. This is the way we can provide trust in our healthcare digital transformation and data strategy. And it's an essential path to help engage both patients, healthcare providers, as well as healthcare deciders in the digital transformation of health. To help all these changes and topics to grow, France has been issuing a number of regulation and process. First, fast access for innovations in clinical use and evaluation has been set up in the last month and is essential to ensure that the fast-paced innovation can be transferred into daily use for patients. New dispositions has been established in France to help innovation transfer from simple idea or prototypes to fully evaluated use for patients. One of the key features is not only to have strong and adequate evaluation of these systems, but also to guarantee a fluid transfer from innovation to clinical use and to do it in a timely manner. Along with this idea, there have been a number of collaboration between France and Germany on how to extend the DIGA policy and define specific strategy for France and to a larger extent also at the level of EU coordination. The next months will probably see new measures to help innovators to bring new tools, new softwares, new evaluation into clinical use. To further help the development of innovation and specifically digital transformation, France has been establishing a very ambitious plan and policy to help healthcare innovation. The President himself presented in June 2021 a long-term planning to help innovation grow in healthcare. Not only with the vision of the French heritage in medicine, but also with the understanding and learning from the COVID crisis. A number of specific axes and strategic directions have been defined, and among those, digital transformation has a special place. To help digital transformation, public policy, fundings, and also centers have been established. ParisSanté Campus is one of the main places for healthcare innovation to grow. Gathering more than 1,000 players in one site, research institutes, startups, corporate groups, healthcare institutions, and government members all together to imagine and create the future of health with digital tools. On one side, everyone is now working together, trying to understand the way artificial intelligence will bring new solutions for clinicians, trying to understand the build of digital twins and the way they can be used in finding new tools or new drugs for healthcare, trying to understand the way imaging is progressing and is completely changing the way we are performing healthcare at the moment, or trying to a larger extent to understand the economical, sociological, and philosophical aspect of digital transformation of health. Alongside these research institutes, 80 startups are now located at ParisSanté Campus and growing every day in a fruitful manner in a large ecosystem, of course collaborating with the national network of innovation and to a larger extent with the international network with the first range of European collaboration. European health strategies are getting more and more structure, more and more important, and the COVID crisis has been accelerated this move. It's absolutely essential to think of all the new evolution for data and digital strategy with this level of EU coordination. In line with this, the COVID has been accelerating a number of process and coordination. at the level of drug evaluation, for example, at the level of coordinated strategy, for example, with the vaccines. And of course, everything that relies to the evolution of data strategy needs to follow the same path. I'm happy that France has been heavily involved through its presidency last year in setting up standards, groups, and perspectives with all the member states to define the way healthcare systems need to evolve in a coordinated fashion. Defining healthcare European data space, defining data sharing strategy are some of the key topics at the moment. And we were happy at ParisSanté Campus to welcome some of the European Health Network to think and define the next step for these strategies. The French government, and especially the French health minister, has been strongly involved in coordinating this reflection with all member states, understanding with everyone what are the functioning of other models in the world at the moment, and what are the choices that Europe wants to make with respect to its data policy in healthcare. There are a number of frames that have been established with the GDPR, for example, and a number of next steps to understand and define, especially when looking at the specific aspects of healthcare data. I'm happy that there are very positive and strong signs that EU is taking this challenge and getting in the right directions. It's crucial that we not only go in the right axis, but also with the right speed. Innovation is moving really fast, and we need to make sure that we put together our European choices when other countries have made themselves and would want to impose them to other countries. ParisSanté Campus will be more than happy to continue its involvement in that path, not only participating but also hosting some of the important steps in this reflection and in the action of setting up European plan for healthcare data strategy, but also in creating coordinated network of innovation in healthcare throughout Europe with the most innovative and active centers. Again, I'm sorry that I could not join today, but I'm very happy to be meeting and exchanging with you in the near future, and I'm confident that this European coordination will bring the most innovative and the most relevant transformation for the best of our patients. Thank you very much. Hoping to see you all soon.
Yes, we're very happy that Mr. Antoine Tesnières was able to contribute virtually and give us a few insights into the French perspective, especially from a viewpoint of the ParisSanté Campus. Since it was pre-recorded, unfortunately, we will not be able to take questions for him at this time, but we'll have a discussion round at the very end of the session, so maybe we can also discuss some of the overarching themes then. But for now, I'm happy to announce our last speaker for today, Ms. Nelli Myllylä. She's the strategy and culture lead at Futurice, a digital transformation company, and she will give us an insight into the Finnish healthcare system and how they approach digital health.
Thank you so much.
Thank you.
Hello, everyone. You can hear me well, right? Hey, in Finland we have a saying that when we have less people, the party gets better. So I'm happy to see all of you here and happy to share these Finnish insights with you soon. A little bit about myself, principal of strategy and culture from a firm called Futurice. I'll tell you a little bit about Futurice in just a second. I have a background in science and technology, but also arts and contemporary dance, so that's probably something that is bringing me back to the stage again and again. And now we've been listening for a long time, so I invite all of you to do a little stretches if you wish for your body. We're talking about health and breathing and nutrition, and in order to learn and digest all of this interesting information, we need some blood circulation. Awesome. Thank you. In my position, I work typically with public healthcare organizations and driving the digital transformation in them on multiple different levels, either supporting them in creating new innovation themselves or mainly adopting. I was happy to hear Hamzeh also talking a little bit about the difficulties of adopting digital tools into use. That's something that we can see very often with the public organizations. We all know, I think most of the European countries are struggling with the same things. We have lack of professionals. Everybody is getting quite tired out there. We have aging population, which means that we need to be doing more with less resources in the coming years. And having worked with these hospitals and organizations really makes me have huge empathy towards those nurses and doctors. And I think some of my missions has become to make these healthcare organizations like wanted workplaces again. So that's something that's really driving me, and digital tools are a part of the solution, I think. Futurice is a Finnish innovation consultancy with more than 800 employees around Europe. We come from Helsinki, 22 years old, and our competitive advantage has really developed during these 22 years. So we started with creating sort of a new style of software and supporting organizations in making digital tools. But soon after that, we realized that actually to change the behavior of the users, we do need the winning user experiences. And that was our second competitive advantage. Thirdly, we were rewarded as the best place to work in Europe many times in a row that we're super proud of. And that did a funny twist in our offering, because our clients not only started asking us to create digital tools for them, but they started to ask, like, how can we create work cultures like Futurice? And that was the sort of next competitive advantage, and has become increasingly a larger part of what we do with organizations. And finally, of course, data, machine learning, artificial intelligence is becoming a strong part of what we offer for our clients. As innovation is in the core, we have also the style of building a family of companies. So every time there's a new theme or an interesting customer problem that we want to dig deeper into, and we have interested people to solve that problem, there might be a new company popping up and that we want to support to grow as well. So that's a strong part of our strategy. There you can also see our values: care, trust, transparency, and continuous improvement. And these are the foundations of the culture, and I will refer to those later as well. My smartphone is presenting with me, so if you hear Siri talking, you can answer her and give your greetings to her. Here's a little bit about the interesting topics that I would really like to talk about, so I'm fighting the time here with my presentation. But firstly, overview of the well-being system in Finland. We've been hearing from France, United Arab Emirates, and there are a lot of similarities, and let's see if we can pick out those small differences in the system as well, and think about those factors that are really driving the innovation and the digitalization in different countries. I've been picking up 4 factors that I think are crucial for innovation and driving it and making it advance faster. Let's see how you feel about those. And finally, a few cases on how we really make the digitalization reality. So basically a few case examples there. Okay, let's dive into the more systemic point of view. We talk about health innovation ecosystems. So how does the system actually look like? As in most of our Western European countries, we have the 4 important sectors in our society. So first of all, of course, the private sector and the companies, then the public sector and the organizations funded by our awesome state money. Then the third sector, associations and non-profits, and finally 4th, families and households, which is not in a crucial role today, although for health and advancement of health, families of course have an important role. The private sector is already covering 22% actually of the social and healthcare services, and they are closely working with the public sector healthcare providers. The employee healthcare is almost totally provided by the private ones. Of course, then the public organizations also buy it from the private ones. So That's sort of the dynamic. The public sector, again, is of course struggling with having less resources. The nurses and doctors are not feeling so well today. And we need to remember as well that Finland is a huge country. So it's almost the same size in area as Germany. But how many people are there in Finland? 5 million? And in Germany, I think 83 million if I was checking my facts correctly. So you can understand the things that we are struggling with. So we have this long, big country, and we need to provide those same services for everyone there. So how do we really distribute? So telemedicine and all remote solutions are very vital for us. Actually, the public healthcare services used to be provided by the municipalities. There's 300 of them in Finland. And we just got a new legislation starting in the beginning of the year, and now we have been trying to centralize providing the healthcare services to 21 well-being services counties. And this is actually a very interesting change in how these services are provided and produced for the patients. We don't yet know if the benefits that have been targeted will take place, but I'm eager to see how it will advance. The third sector has an important role in supporting the public sector who is struggling now. So if in the work life, in the hospitals, we talk about taking work from doctors to nurses. So what we can see from the ecosystem point of view is that the third sector is thinking on how they can support the public sector overall. So this is an interesting interplay between these two sectors. And also in Finland, the third sector is quite independent, so only 30% of the funding is coming actually from the state, which gives it a different kind of flavor than potentially in other countries. Of course, everything is led by the Ministry of Social Affairs and Health, and Business Finland and Sitra are few innovation funds that are led and coordinated by some of these ministries. And I think that's an important part in supporting innovation. It was interesting to learn about Spring yesterday, Sprint, one of the innovation funds that you have now in Germany. And I think that's a good start on also boosting the innovation. Okay, so that was the system. How does it look to an individual then? This is my daughter Selma, and she is 1 day old. And the day she was born, she had her own e-data record. And I could be following her data from there. And in Finland, we have already a long history of putting things in one place and having shared databases for different kinds of information and data. I will get soon back to that. And of course, it doesn't end with her life, but the data is there even when she's gone, and for us to use for research purposes and to learn and innovate as well. Here you can see a few examples of the digital tools that also the public healthcare organizations are providing. So this is Selma's view. I'm gonna reorganize a little bit here. So this is when she was born, 3rd of September 2020. So we can see that we've been in the hospital. It's called Jorvin Sairaala, Jorvi Hospital. And we were let go on the 5th from the hospital and then returned home. And we've been visiting the child healthcare services and having some calls over there. And you can also see some of the doctors that me, have been calling with. But this is the Selma's own view, and this is one of the services that I can use in the area where I live in the capital, Helsinki region. And here's another example that is now getting more and more popular as well on the public side, that actually the telemedicine solutions are also provided through the public healthcare organizations, which is quite new in Finland as well. So you can chat or have a video phone call, for example, with your doctor too, in order to solve your business a little faster. Of course, public sector is hugely following the private sector, so private sector is leading and the public ones are like, oh, how do we catch up? But that's where the state sort of comes in and supports with funding, of course, but also directing and giving guidance, supplying methodologies and different kinds of tools. So there also we can really benefit and enjoy the sort of ecosystem collaboration. And that's important in Finland, the private-public partnerships. Yes, electronic patient record systems, there are different ones. So one could ask maybe, Finland, 5 million people, how many electronic patient record system does country size of that need? The answer is 9 currently. Not everybody agrees with it. I would prefer having just one, but you know, sometimes we need to go bottom up in order to come top down, as Alexander was also saying in the beginning. But still, the data flows into one database, and we can see our own health information and which clinics we visited and what different kind of prescriptions and data has been collected of us. Prescriptions, I've heard these interesting stories that in Germany sometimes you get it actually on paper, as Alexander also said. And that's not happening in Finland anymore. So the prescriptions are online and I can go to any pharmacy. If I leave Oulu and want to buy my drug in Helsinki, that's fine. All the pharmacies can access the same database and provide me with my drug. And the medical imaging is also stored in one database, so I don't get any printouts that I would need to keep and sort of have with me for the next specialists, but they're all there, and in the future I'm sure we can also take a look of them through the public services. This is Oma Kanta. It's like, how would I say, my base in a sense. So this is my view on all the information and data stored of myself. So here, for example, you can see that I've been visiting Vatsakeskus Keskussairaala. I was part of a research group and gave some of my blood there. And here you can see that I've been looking at my health information. I can take a look at my diagnosis, the critical risk information, the radiology results, lab, and so on. And what's funny with Oma Kanta is that the latest development is that actually you can connect data from private services to Oma Kanta as well. So a diabetes app or a exercising movement app and these kind of things. So that's something that I'm really looking forward and seeing how that will develop in the future. That's FAST, the system, the latest on the digital part and how it looks like to me as well as a user. So what is then supporting Finland in advancing this digitalization? And would love to have a discussion with you as well about these factors later on and how you see those in Germany. So first of all, trust. Then I picked also the startup culture that has developed quite drastically during the past 20 years in Finland. The state does have a role, and I really consider that being an important role. Alexander, in the beginning, he was talking about this top-down versus bottom-up, and I really agree with him that it can't be totally top-down led. We need to collaborate. But on the other hand, the state still has possibilities to bring us together, bring those private and public organizations to the same page, in a sense. And then, of course, the 60 years of data that we have, genetic data and other kinds of data that can be used for research and innovation purposes, has a strong impact. Alexander said in the beginning, he said that this top-down approach in Germany, for example, has made people be a little bit like rejecting towards some of the top-down led initiatives. That was my interpretation of what he said. And I was thinking, yes, that's probably about the top-down approach, but also we need to consider to which audience or context the top-down approach lands into, right? So in Finland, some of the top-down approaches land in a context where people are trusting those public organizations. They're like, okay, if the state says that must be good, sounds okay, I trust them. And this is not the same in every country. The sort of corresponding figure that I found from Germany was between 22 and 37%, depending a little bit on the governing body. So that's something maybe to think about. How could we change that? What is that trust depending on? Why aren't we trusting? So Finns really share their data for the greater good. Finland has actually passed one of a little bit progressive legislation lately, which is Act on Secondary Use of Health and Social Data, which now really enables the usage of anonymized and pseudonymized data for research, innovation and education purposes. And this is actually really cool. And Finland has been driving also the same development to EU and the Commission. And the Commission is actually now, as I think Antoine was also referring to, preparing the regulation for health data space governing. So how we could individually have more control of our data and how we could together benefit more of that data in the European area. State-level support for innovation, this is what we talked about a little bit. We have those innovation funds that have really, it has been proven that they have been supporting well-doing startups. And I think it does have a huge impact. Of course, there might be specific initiatives supported by the state reacting to the changes, COVID, what have you. And then we've been also supporting from the state level this formation of Clever Health Network. I don't know if you've heard about it, but the Helsinki University Hospital is driving that together with private organizations and other research institutions. And they have been researching, for example, on how AI-based diagnostic tools can be used to examine hemorrhages. So this is some interesting development that demands all of us, can't be done in a silo. Here are a few examples that have been supported by these innovation funds and that have been developed together with the state. So here you can see Oma Olo, it's like My Feeling app. And became especially popular during Corona times. So it asks you how you're feeling, and it's sort of an symptom assessment tool, basically. So you fill in a form, and this was especially crucial for Corona times because, you know, everybody was flooding into the healthcare centers. Like, do I have Corona? Can you test me? What should I do? Wow, where do I go? So people are filling in the forms, and this is also a medical device, so it either directs you to a professional or then gives you self-care instructions that you can then use to take care of yourself. And Health Village is another state-funded tool, and it has been building different kinds of knowledge hubs for different patient groups, but also for the employees side, the professionals. So the professionals can go and check out the latest on what's going on in methodologies in their area of expertise. And additionally, Terveyskylä has been trying to popularize the care path development in a digital format. I'm not personally a big fan of their digital solution. You know, I come from an innovation office, so to me it's a little, but it's still generalizing it. It's supporting those poor regions up in north and elsewhere in Finland to also have something that is pretty digital and pretty innovative. So still having good development there. Startup culture, private sector working together with the universities and actually building something really unique. I don't know if you're familiar with Slush, a large innovation and startup scene happening in Finland every year. You should come and visit if you have an idea, and you should definitely Google it if you don't know it. And Arctic 15 in a similar manner, trying to connect the fantastic ideas with the money looking for a pocket. Here are some examples of the sort of latest healthcare startups. Oura Ring. It's a smart ring that you have just around your finger and especially focusing on recovery. So we have a lot of smart apps trying to push us to be better, make better, sleep better, eat better, do better. So Oura is more about, hey, how you relax. What is your readiness for the day? Hey, Nelli, you didn't sleep so well after the wine glasses yesterday at the fantastic party. Maybe you should take it a little easy. Nightingale is another one, which is a connection of a digital tool and a blood sample test that you take at home and then you send it back to Nightingale and they do the analysis of your healthy years and provide you with recommendations on how you can actually increase the amount of those healthy years that you have ahead of you. Finally, we can come back to the 60 years of data available to be used for research and innovation. It's especially focused on the genetic data as well, and more also on the biobank data, which you can then through Omakanta, for example, you can opt in and share your data. And we are fastly accumulating the amount of data to be used there. So that's something super cool. And of course, this is the start for the preventive and the personalized medicine in a sense, and an important part for innovation in that area of healthcare. Okay, so a few examples on how this digitalization can then become real. As Futurice, we see different organizations struggling with believing that something can actually change. And that's a big part of our job as well, to be there to support people in believing that the change is there. And I wanted to pick this very famous quote from Nelson Mandela on that I think really summarizes on how the change actually goes. So typically you have 80% of the time everybody's like, yeah, okay, I don't know, maybe a little skeptic. And then when it's done, everybody's like, oh, of course, it's been always like this. And you know, all the struggles are forgotten. But the amount of discussion and disbelief before, we all know, I'm sure we are all involved in digital innovation and can know how hard the change and creating something new from scratch is. But hey, here, all of us, let's not stop believing. What we do now in Finland as Futurice and globally as well. So our core mobile apps. This is a private sector company from Finland, one of the largest employee healthcare providers in Finland. And we've been together with them in a long partnership developing their own mobile app, which also has telemedicine included and all the nice things. This was actually a nice project that we did with the same client, and we focused on supporting their growth. So hiring new nurses, new doctors. So the newbies are always like, oh, but now who I ask and where do I direct this patient and who knows about this? So we took a bunch of their data from their e-health data records of the patients and as well from the resource management systems and put this together. And with the help of AI, we managed to support them in finding the right talent in the right time. It's actually based on a tool that we also created for ourselves in Futurice, because while growing, we've been suffering of the same thing. You know, you don't meet everybody at the coffee machine anymore. You don't maybe meet your new colleagues that you have on other sites. Here is my colleague Luis, who has been supporting me with the speech. And so getting to know who's there and what they do is important. This is a larger case that I'm going to only say a few words about, but one of the well-being counties, Päijät-Häme, has 250,000 inhabitants and 7,000 workers in their well-being county. And we've been supporting them all the way from the managerial support. How does the management actually prioritize our development backlog? How does the management decide where we implement telemedicine solutions or telemonitoring first? Then we've been supporting their IT in building innovation capabilities, so user centricity, coding, creating software, building cloud capabilities, so how can they, in a scaling manner, use the cloud and actually fast create different kinds of solutions on top of that. So this is something that I've been very, very, very proud of, and the work is still continuing, and I hope we can create a lot of good stuff. Customer journeys, Hamzeh was talking a lot about like how you involve patients and being user-centric and customer-centric, and I guess that's a topic we can't really highlight too much. And we've been creating, for example, customer journeys to young adults diagnosed with cancer in order to have more impact on their treatment, but also support the mental burden that having cancer as a young person might create, and therefore also improve the customer experience. And the customer experience is something that is really crucial and should not be forgotten in these digital developments. And then one more example on automating the COVID vaccination queue. So we all know COVID came super fast. At least in Finland, all the public healthcare organizations were like, oh, okay, no, now I need to vaccinate like the population. What do I do now? And actually to be able to react fast, we were supporting different cities in using digitalization to distribute those vaccines and get the queues, get people to register to their vaccination. And that was a cool case, which was done in 2 months. So that's sort of inspiring, at least to me, that was a really rapid development. And the city was actually with us. Sometimes the public organizations can be like, they don't really change with you. But these guys, they were on top of the speed of change that Antoine was also referring to. Finally, a snapshot on some of the tools that we have been developing. So This is a connected health kit tool that helps you to map out a certain part of a process or a whole process and understand which part you would like to develop a digital solution into, for example, or solve in another way. And one of the key benefits with the health toolkit is that you create a shared understanding of the situation, the issues, and the potential that you have. So strong recommendation for this, and I still think that Luis has a few of those flyers left if you're super interested, but on our website you can find out all about it. This would be it from Finnish Insights today. Thank you for listening.
Thank you so much. Oh. I don't think yes. Thank you so much, Nelli, for these insights into this advanced Finnish system, especially the database, very centralized database that I think many countries can only dream of. And I don't think we have time for a very extensive Q&A session, but maybe if someone has just one quick question for Nelli and what she just presented about the Finnish insights. Any questions? Yes. Up there. Wait.
I mean, you are so innovative, and we have it, and you don't. You know.
Once more, what was my perspective on the
German DIGA?
Okay, and what is DIGA?
Oh, it's the digital medical device which can be prescribed by doctors.
Okay.
Or if you don't know it.
Yeah, no,
okay.
Totally.
Yeah. Yeah, I think it's a very unique system that you can get prescribed certain apps from the doctor and then get them reimbursed by your medical insurance.
Interesting.
Yeah, that's the DIGA is what it's spelled.
Cool.
But yeah.
Hard to take a stance on this small information, but at least it sounds interesting.
Yeah. So maybe more of a follow-up for later.
Yeah.
Okay. Well, I think then it's time to close the session. I would like to thank every speaker for contributing these interesting insights into their respective areas. And I think as a conclusion, we can say that we have a lot to learn from each other, and there's still a lot to be done globally to actually foster the digital health transformation that is user-centric and actually involves patient and fosters all of our systems. So as maybe a conclusion. Thank you all for being here. Thank you all for working in the space, and thank you for to the organizers for everything.
Also, thank you very much, Svea, for the great moderation.